Okay, so this is Isabella, and she uses a nebulizer. It looks like this. It's got an on button and it's got an attachment to connect the hose. And the hose leads to the face mask and the little dish that you put the medication in. She uses albuterol for her breathing treatment in particular. Albuterol is a bronchodilator. It comes in like a little plastic capsule, maybe about like this big. You break the lid off of it and you dump it in. It's like the consistency of water. And then you put the lid back on and you fit the mask over their head. Make sure that it's fitting firmly. And she knows how to do this herself. If I tell her, go do your breathing treatment, she knows what I'm talking about. The reason that she gets a nebulizer treatment is because she has a severe dust allergy. And for a really long time, we couldn't figure out what was going on. We were concerned that maybe she had asthma or maybe there was something else going on. We actually went all the way out to Lou in Chicago for cystic fibrosis testing because really we just couldn't figure out exactly what was going on. She would have these sudden attacks, and it was with coughing as well. She would have like this productive cough. There'd be nights where she would wake up and her breathing was so horrible that she'd be retracting and really using her accessory muscles. A couple nights before we got our diagnosis of this severe dust allergy, I woke up to her breathing just horribly, and I took her into the emergency room, and she was satting at about 86, 87%, and her lip up here was kind of blue. So they hurried up and did a nebulizer treatment on her and then sent us home. The ER doctor assumed that she had asthma, but again, that was not our diagnosis. Her doctor had decided that's not what she had, and we were still trying to figure it out. It was really stroke of luck that our doctor decided to just do an allergy panel. Before I administer Isabella's breathing treatments, I like to check her heart rate and her breathing, just to get like a baseline of where she's at in case like the albuterol treatment doesn't work well and we have to go to the emergency room. Because that happens sometimes. Her dust allergy is so bad, and it gets especially bad like in the colder seasons. Sometimes we have to go to the emergency room because the albuterol treatment didn't work. We have, I forgot the other one. There's another medication that she uses that she inhales, and I can't remember the name of it for my life right now. But we try that, and if all else fails, we do have to go back to the emergency room for treatment. But I like to listen to her breath sounds. She's usually very wheezy. She has a chronic cough. If she coughs for you, she just always has this wet cough. No matter how hard we try, we can never get rid of it. Even with the treatment, she takes Zyrtec every single day. But yes, I like to listen to her lung sounds beforehand, and then I also like to listen to her heart, and I like to take her pulse so I can get a baseline because the albuterol makes her a little bit tachypnic. So when I get into the emergency room, I kind of have like a story to give the emergency room doctor, like this was her baseline. She did have an albuterol treatment, so if she's a little tachypnic, that's okay. But if she's having any other heart complications outside of that, they know that that doesn't have anything to do with the albuterol or like her breathing, or it might have to do with her breathing. So yeah, she's kind of complicated, but we make it work. Can you say hi? Hi. Can you cough for us so we can hear your wet cough? Cough. Please, can you cough? I want to hear your cough. Just cover your mouth and cough so we can hear that you always sound rattly. Please. It's for all the other, for my instructor. Okay. Okay, so she quite literally sounds like that every day of the week for a very long time. She's always sounded like that. So yeah, that is our albuterol treatment. It does have a little on button. You turn it on and it is a little bit loud. So that is our story.